For laboring patients needing a cesarean section or for elective C-section patients, a spinal anesthetic is the preferred mode of anesthesia. If there is not an epidural already in place, or if the labor epidural is not working well before your C-section, an anesthesiologist or nurse anesthetist will come to your room to discuss the risks and benefits of spinal anesthesia. If you're on a medication called Subutex, you can expect a similar experience, although the anesthesia provider may be altering some of the medications you receive.
Hi there, I'm Greg. I'm your nurse anesthetist. Nice to meet you. I know that you're going to be having a C-section. I've reviewed your health history and your allergies. It looks like everything is in order. Do you have any particular questions for me or concerns?
Yes, I'm terrified of needles and I'm feeling really worried about having a spinal. Is there any other way to do the surgery?
General anesthesia is another thing we can do. However, we generally save that for emergencies or when there's contraindications to having a spinal. Most of the time we like to do a spinal anesthetic so you can be there to see your baby and bond with your baby at that time. It's also the safer of the two options.
Okay, that makes sense.
Although spinal anesthesia is very safe, there are some complications and risks we need to talk about. Those risks include bleeding, infection, nerve injury. The risk of infection is minimized by the disinfectant we use to clean your skin, but it's the same kind of risk you'd have as getting an IV. The most common risk we see is something called a spinal headache. That happens in about 1% of the patients, a particular type of headache that usually occurs within the first 24 hours after the procedure. There are ways to treat that, but would normally resolve on its own. If you have a problem, we'll talk about it at that point. There is a risk of nerve injury, but that is minimized by the fact that we put the spinal in below the level of the spinal cord. So there's very little risk of injury to that. Any other concerns?
What would I feel or experience during the C-section?
It's very common to have problems like nausea or shivering during the procedure. The nausea is usually caused from a drop in blood pressure. If you're having any nausea during the procedure, make sure you let me know right away so we can give you fluids or medicine to treat that. You could also have some tugging, chest pain, or other symptoms. If you have any of those things or it becomes too much to bear, let me know and we can give you some other medicine, okay?
Will you be with us the whole time?
Either myself or another provider will be with you the whole time during the procedure. You're also allowed to have a family member or a friend or someone in there with you. Any other questions?
Now that I've learned more about the spinal, I feel a lot more comfortable.
Great. I'm going to go and get some things set up in the operating room, and I'll see you back there in a few minutes, okay?
Okay, thanks.
Certain health conditions or emergency situations may inhibit the ability to safely administer a spinal anesthetic. In these situations, a general anesthetic technique is used. Family members may not be present in these cases. There may be several other staff members in the operating room, including your obstetrician, a surgical assistant, and a circulating nurse. For the baby, a nurse, respiratory therapist, and neonatal physician or nurse practitioner may be present. Their presence is essential to help care for you and your baby.
Okay, proper positioning is extremely important for this. So just try to keep yourself relaxed. I will tell you every step as we're going through this, okay? The first thing we're going to do is wash off your back with some cold soap. It's going to be cold and scratchy. We're going to do that 3 times. Here comes the cold.
To place the spinal, the anesthetist and nurse will guide you into the proper positioning and connect several monitors to you.
And I have one more here. The next thing we'll do is put up a cool plastic drape. That's just to help keep the area nice and clean. You're going to feel a poke and a burn. This is very similar to what you felt when you got your IV. I want you to push your back out right here where I'm perfect. Okay, you're going to feel this poke and a burn. Okay, how was that?
Not as bad as the IV.
Very good. Now at this part, you should just feel some pressure. I want you to try to stay relaxed. It should take just a minute or so. If you feel anything sharp, or if it doesn't feel like I'm in the middle of your back, just let me know, okay?
If you are experiencing contractions, the anesthetist will try to work in between them as much as possible. However, there may be certain parts of the procedure where they will have to continue regardless of a contraction. Hold your position as well as you can.
All right, we're in that spot. We're just going to be injecting the medicine. You might feel some warmth as I inject here. Is that okay?
Although it usually only takes a few minutes to place the spinal, finding the right position could take a longer time depending on the individual patient's anatomy or size. When placing the spinal needle, sometimes there's pressure or a shock-like pain sensation down one side or the other. This sensation usually passes quickly. It only takes about 5 minutes from the time of spinal injection to when the effect is adequate to perform the C-section without pain. During those minutes, your nurse will place a Foley catheter to drain your bladder. The nurse will also wash your abdomen with disinfectant to prepare for surgery. Once the drapes are on, and immediately prior to the beginning of surgery, the obstetrician will test one final time to make sure the spinal is working adequately to continue.
All right, we're going to test you now and make sure you're nice and numb. Let me know if you feel any pinching. Let me know if you feel anything sharp.
Just a little pressure, no pain or anything.
Okay, we're going to get started and get this baby.
After the procedure, you'll be moved onto a stretcher and taken back to your room to recover from the spinal. Anesthesia sensation usually returns within 2 to 3 hours, but some areas may take a little longer. The anesthetist will also add a long-acting pain medication that will help with pain control for the additional 16 to 24 hours. If you do have increasing pain after the spinal wears off, let your nurse know. They'll be able to give you additional IV pain medication as needed. The anesthetist may also administer another type of block called a tap block while you're numb to help with pain after your surgery. There is also an anesthesia provider in the hospital at all times if you have any additional issues, questions, or concerns. If you're on either of the medications called methadone or Subutex, your surgeon may take care of your postoperative pain control along with the long-acting spinal medications or tap block.